Hepatitis A.
Infectious agents such as bacteria, parasites, fungi, viruses have different effects on livestock production with a generally negative impact. Viruses, in particular, can cause different diseases in animals, humans, or both.
En ambas poblaciones. El virus de la hepatitis E es considerado un agente zoonótico. Para la Organización Mundial de la Salud, una zoonosis se puede definir como cualquier enfermedad o infección causada por diferentes agentes transmisibles de los animales vertebrados a los seres humanos y viceversa.
The greatest transmission risk for zoonotic diseases is found in human-animal interaction through direct or indirect exposure to products, waste, or the environment. Hepatitis E is considered an emerging zoonotic disease and constitutes a risk to public safety because of the propagation of previously unknown infectious diseases in humans that emerge out of the animal population. This makes it necessary to implement specific preventative interventions among the different actors involved, starting from primary production, in this case pig farming, and going through the rest of the stages on the production and commercial process. This involves people in the general population, people in direct contact with animals, zootechnicians, veterinarians, as well as occupational and public health professionals.
Hepatitis is defined as the inflammation of liver tissue that can happen as a consequence of an infection by a microorganism or as a consequence of intoxications.
Según la Organización Mundial de la Salud, la hepatitis es causada principalmente por infecciones virales. Los principales virus causantes de la hepatitis están designados como A, B, C, D y E.
If we're going to classify the different types of hepatitis, we could say that hepatitis A and hepatitis E share some clinical and epidemiological characteristics because of their modes of transmission and because of their clinical picture, while hepatitis B, D, and C have other epidemiological characteristics and other forms of transmission.
The hepatitis E virus is transmitted primarily via the fecal-oral route because of fecal contamination in drinking water. Other transmission vectors that have been observed are food through the ingestion of products made from infected animals, such as livers or raw or undercooked intestines. Zoonotic, meaning it can be transmitted from animals to humans through transfusion of infected blood products, and vertical transmission from the pregnant mother to the fetus.
Hepatitis E is one of the types with the fewest reported cases worldwide. However, it is very important in Central and East Asian countries.
La Organización Mundial de la Salud estima que cada año se registran 20 millones de casos de infección por el virus de hepatitis E. Más de 3 millones se consideran casos agudos y se reportan cerca de 70,000 muertes relacionadas con este tipo de hepatitis. Por lo tanto, es una cifra que debe ser tenida en cuenta por los sistemas de salud.
Let us remember that transmission of hepatitis E has a lot to do with sanitary systems in countries where there is not adequate disposal of excrement or access to potable water. The risk of transmission is very high. Patients that are infected secrete hepatitis E particles in their feces. These can contaminate water sources, contaminate food, and other people with access to this water and these contaminated foods will be infected. That's why in a country like Sudan, which is a country that's long been at war, which has very deficient sanitary services, there was, towards the end of 2012 and beginning of this year, a major epidemic outbreak at a refugee center. The clinical presentation of hepatitis E is comprised of specially acute symptoms, although the incubation period of the illness is between 4 and 8 weeks, with an average of 6 weeks. The second signs and symptoms the patient will exhibit are general malaise, asthenia, adenomia, which is nothing else than the fatigue the patient feels. They will have a fever and exhibit jaundice, which is the yellow pigmentation in the skin, the mucosa, and on the white of the eye.
Symptomatic transmission is more frequent in people ages 15 to 40. There is also a great risk to pregnant women and to immunosuppressed individuals whose immune system is weakened due to transplants, leukemia, HIV, and others.
The majority of hepatitis E cases are self-limiting. This means that the patient presents the illness and has some symptoms for a period of time, and 2 or 3 weeks after presenting this general malaise, the patient will recover from this jaundice, even without treatment.
Incluso sin haber recibido ningún tratamiento. Sin embargo, las personas que mencionábamos antes o los grupos poblacionales entre los que están las personas que tienen un...
However, the people we mentioned before, or those groups such as people with compromised immune systems or pregnant women, are an important population because in this type of populations, complications can appear, such as a virulent hepatitis that can kill a patient.
A una muerte del paciente.
We know that in our country we find the genotype 3 of the virus, so taking into account that this genotype is in circulation in the country and that neighboring countries like Brazil, Bolivia, and Mexico have reported hepatitis E cases in humans, it's important for the healthcare system and for infectious disease doctors in the country to be on the lookout for possible cases of hepatitis E in our country.
Ante posibles casos de virus de hepatitis E en nuestro país.